So today's topic is going to be on women's sex hormones, and I'm here again as always with Dr. Christopher Roberts, and he's going to kind of give us some information on women's hormones and why our practice is a little bit different than maybe other practices you've been to or some of the online practices. So Dr. Roberts, will you just kind of give us an overview of women's hormones and then maybe dive into how our practice is a little bit different than others?
Yeah, women's hormones, typically ladies that are postmenopausal, although sometimes ladies who are prior to menopause or premenopausal need some hormonal support. What we really focus on here at Customized Relief is we personalize management. We do measurements, etc., so that we're treating patients not with kind of the cookie cutter approach, but a more personalized plan.
So that being said, what are the different types of testing that you would usually see us do prior to initiating hormones? And then to piggyback off of that, what are the different methods of hormone delivery?
Great. So testing is really important with this. We actually use several different labs. Kind of our favorite for testing hormones for estrogen, progesterone, testosterone is ZRT labs. You can do this either as a finger stick test or a saliva test. The test is not that expensive, and again, it's a really good way of telling us what cellular levels of hormone replacement therapy are. We really like a new test that we've got through Vibrant Health, though, called the Hormone Zoomer. And it's really nice because it's a urine test that measures for metabolites. We can even see how hormones are cleared, and this can be really important for even things like, is a patient at risk for cancers, etc., and how do we modify our treatment accordingly?
So that being said, how does a woman know that they are in menopause and that they should maybe start initiating hormone replacement therapy?
Yeah, most of the time it's if you have not had a menstrual cycle for at least 6 months and you have an FSH level, follicle stimulating hormone level, that's high, usually above 50 or so. Again, ladies who've had hysterectomy, it's a little harder. You would then have to sort of go by what is their FSH, but also what their symptoms are. The nice thing, again, though, is the testing that we do will give us a better idea of, are they deficient and really in all hormones of the three we discussed, or is there just one or two that we need to replace?
And I'm going to kind of backtrack a little, take you back to the early 2000s. There was a study that was done. I'll kind of let you dive into this, but we get a lot of questions about, am I going to get cancer from going on hormones? Fortunately, I know there was a recent black box warning withdrawal on estrogen, but can you kind of tell me what that study was, maybe the flaws in it?
Yeah, I've been in practice for about 30 years, and it was the Women's Health Initiative trial. Patients were taking Prempro, so it was an oral hormone replacement therapy. It was an estrogen that came from pregnant mare's urine. That's what Premarin is. But the progesterone was actually not a progesterone, it was a progestin. What they've discovered since that time is that if there was an increased risk, and that study, again, initially did not show a statistically significant increased risk for breast cancer, if there was any risk, it was the progestin, not progesterone. We only use bioidentical estrogens and progesterones when we do replacement therapy.
What are some of the benefits of hormone replacement, specifically related to not just bone health, which we know a lot about, but even cardiovascular, some of those other?
Great question. So most of the time, if ladies can start on hormone replacement therapy within 10 years in the menopause, there is upwards of a 50% reduction in cardiovascular disease. Cardiovascular disease is the number one killer for women. You put all cancers together, it doesn't come close to measuring the number of women that die from cardiovascular disease. So you can see a significant reduction there. When we look at things like bone density, you just mentioned osteoporosis in particular. Osteoporosis kills more women per year than does breast cancer. And yet, again, you had a generation of women that were deprived of hormone replacement therapy, and now they're on a whole slew of medications that have side effects and frankly can be deleterious to the bone if taken long term. That's what the current standard of care is. Estrogen slows the loss of bone over time. Progesterone and testosterone actually help to build bone back that you've lost. The third one, and people talk about cancer, the studies right now show that estrogen and progesterone do not increase your risk for breast cancer. Progesterone actually has been shown in 2 studies to lower your risk, not progestins, progesterone, lower your risk for breast cancer. But every study to date has shown that estrogen lowers your risk for colon cancer by 50%. Nobody wants dementia. Big study done showed that if you've been on hormone replacement therapy, estrogen in particular, for at least 10 years, you have a 47% reduced risk for any form of dementia.
And I think one other one I just want to touch on, because we see it a lot, is just the mood.
Yeah.
The depression, the anxiety, and how detrimental that can be to individuals as well. And we see firsthand the boost that the mood plays, and that's a really big part as well. So
very well said. Estrogen is really, really important when it comes to kind of improve sleep for patients. It helps with deep sleep in particular. You sleep better, your mood's better, your inflammation is lower. The other one that people forget, though, is that ladies really need testosterone replacement. This is unfortunately something that's not taught in the OBGYN residencies, but actually the highest hormone level a woman has, even when she's going through menstrual cycles, is actually testosterone. Now, women are about 1/10 of the level of testosterone as men, but it still is a very necessary hormone because testosterone really helps with sense of well-being. It helps with bone density, as we mentioned, helps to make bone stronger. It also helps with muscle build. Again, as we get ladies moving into their latter years, building muscle for both men and women is really, really important.
Right. And then on that front, what are the different methods of hormone replacement?
Great. We don't really like oral estrogen because, again, that can increase risk for blood clots in the legs and also stroke. So we always like across the skin. So you can typically, with your insurance, have a patch covered. Usually with estrogen, I'm not a huge fan of the creams, although a lot of people use the creams. Those are probably the more classic ways of receiving that. Progesterone, we like to go oral, and the reason for that is progesterone, if you take it orally, actually significantly supports better sleep, which again, really important for overall health. And then testosterone is kind of the neat one because we have many options for that. Some people will use an estrogen cream for that. Some people will use a testosterone cream. Other people will use a testosterone troche. And so these are little gummies, and I forgot to mention earlier that you can do estrogen in this form too, that you put kind of between your lip and your gum, and it sort of slowly absorbs across your mucous membrane into your bloodstream. But we're kind of excited on the testosterone front with injectable. Now, if you get the right dose of injectable, it's once a week under the skin, very effective, really cost effective, it's inexpensive, but it can be, as we've seen from some of our patients, life-changing for them. Last one, and this is kind of a newer one that we're really excited about. This is called LPT testosterone. And this is actually a chewable form of testosterone, bypasses the liver, so there's no risk going through the liver, but a really neat way of kind of getting the replacement therapy back in.
Yeah. Well, thank you for all of that. I hope that you all have a better understanding of hormones, but also kind of how we approach them a little bit differently. Like you said, not cookie cutter, it's very individualized. We're always testing, making sure that the labs correlate. Obviously, symptoms are a big part of it, so we want to make sure the symptoms are improving, but not at the fault of maybe some of the labs getting at places we don't want to be at. So thank you for listening, and I look forward to talking with you soon.